So we talked about, why are we going down this process of accreditation, and what do we get out of this? Because it is going to be a fair amount of work for a lot of us. And it's going to be a long-term commitment. It's not something that we just do, hang a plaque on the shelf once the formal accreditation team from the nation, the formal Public Health Accreditation Board, which has been recently created, will come out and actually do a site survey at some point in time. And if we sort of pass all the standards that they're going to look at, we will get accredited, and that accreditation will be good for a 5-year period of time. But that doesn't mean that the journey is over. We're making a really long-term, kind of a forever commitment to the tenets of accreditation, and Marty spoke to the fact that this really is about quality and performance. It's asking ourselves as a department and sort of as a discipline, how do we know that we're doing a great job? How do we know that we are really contributing to population health improvement? And going down the rigors of answering those kinds of questions will really, I believe, help us better sell the value of public health, particularly in the context of health reform, when we have a nation that is, frankly, paralyzed over how to improve the health of the population and do it cost effectively. Because this multi-decade-long strategy of spending more and more and more money to treat illness isn't helping the nation get healthier. That doesn't mean it's unimportant to treat illness. That doesn't mean the safety net system is any less important whatsoever. But what it does mean is that we have got to invest in prevention in this nation. And we believe that public health and local public health departments are the best leaders to do this, particularly at the local level. Next. So we talked a little bit about the triple aim of health reform and why the context of that is important for accreditation. Because the Affordable Care Act, or as we know, commonly as health reform, is, I think, the most significant lever for public health in certainly my lifetime. Because what it's saying on a national level is we spent too much money, we're not improving the health of the nation. In fact, there's statistics out there that say our children will live shorter lives than we do. When you look at some of the factoids around diabetes and obesity, it's scary. The notion that 1 in every 3 of our children born today will potentially grow up with diabetes, 1 in every 2 of our Hispanic children, that is unacceptable. And we cannot spend our way to treating that sort of illness and hope to achieve health. So the triple aim of health reform is said to the entire delivery system, which is way on the other end of the continuum of public health, because we're way up on the upstream, and we're trying to move even more upstream. But it's said to our partners downstream, where about 98% of every dollar is spent. It said, this strategy isn't working anymore, and we've got to take a hard look as a whole nation at moving these investments more upstream, and that's public health. And it just so happens that our own health and hospital system has really sort of gone through a shakeup in the last year or so, and really said, you know what, if we're going to really aspire to health reform, we've got to have a strategic plan as a system. And Renee Santiago, who, if you're around here about 1 o'clock today, he's going to make sort of a cameo appearance to say hello. And so if you miss him, I apologize for that. Renee comes to us from San Diego County. He's a great leader. I'm really excited that Renee's on our team. He's been here about a year now because he understands public health. In San Diego, he actually ran that. They sort of have to our environment. And so we think we can apply public health approaches and methodologies to address those sorts of things too. So another reason we're going after accreditation, and I mentioned this a minute ago, there's been more than a decade-long journey and conversation led by APHA, NACCHO, the CDC, many large local health departments, including our own. Dr. Fenstersheim is actually one of the thought leaders in this nation on this whole journey, really to help define what public health is and to develop the 10 essential services, the 3 core functions of public health, sort of around that circle on the big wheel on the outside are the 3 essential services: assessment, policy development, and assurances, and then on the inside of the circle, sort of in the slices of the pie, are the 10 essential services. But the accreditation process actually asks us to look in each of those 10 domains, and then adds a couple of additional ones like governance and an organizational structure to it. But we'll be evaluated based on how well we're performing in each of those 10 areas, and then a couple of additional ones. And are we transitioning to you on this one, Rocio? Remind me. You only got one. So am I doing this one too? I told you we're going to practice this, guys. So these are actually the 12 different domains upon which that accreditation group, I think it's a team of 3 to 5 folks, will come out, spend a number of days, if not a week or so, with us in probably in late 2014 or early 15. And they'll sort of take a really long look at how well we're doing in these 12 different areas. And you'll see that it's a pretty broad swath of activity. It's everything from workforce development to how we run the department administratively, our governance structure with our board of supervisors, how we investigate diseases, how we assess and report on health findings and health profile work, and everything else in between. One of the things that I'm also kind of personally excited about, there's a section about public health laws and a section about policy, and it's the recognition that we can really improve health through public policy. Because frankly, it's public policy that shapes the environment. It's public policy that decides whether we're going to build, bike trails or bike highways, right? Like they do in Holland. They don't just have bike trails, they have bike highways. People don't drive over there, they ride on their bicycles because they have an infrastructure. They've created public policy that enables that. And so those are the kinds of things that we can bring to this nation as well. And we have a number of great examples where policy's been a leader. Immunizations, water fluoridation. In fact, Dr. Fenstersheib is, again, been on a multi-year journey to bring water fluoridation to this county, and he is at the point of near success. They've had some great strides in the last year that he's really contributed to getting a group of folks together to commit to financing water fluoridation in our county. So he could talk more about that in a minute or two. I thought this was your slide, Rocio. So it also reminds me that, I guess I'm doing this presentation. It reminds us, this journey to accreditation reminds us that we're not alone. And again, when I remarked earlier that if you've seen one health department, you've seen one health department. We are on the cusp of changing that forever in this nation. When you've seen a health department, you'll be able to define what a health department is, particularly those that are accredited, those that have submitted to the standards and the rigors of really those 10 essential services. And it reminds us that we are not alone. We are surrounded by an amazing group of colleagues, and particularly here in the Bay Area. Coming from a smaller state and a smaller health department before I joined all of you, I just relish in the depth of team that we have in the Bay Area, particularly in California, and in the nation. And this is sort of just some of the larger players in this on the national front. A lot of those folks will be familiar to you. The Robert Wood Johnson Foundation, as you know, is the foundation of the Johnson & Johnson Company, and been a major financial sponsor to this effort, as has the Robert Wood Johnson Foundation. So, but in a nutshell, what accreditation really is about at its heart and soul is quality and performance. And so all of those 10 essential services really lead to us submitting to a high quality product at the end of the day and asking ourselves, can we do it better? And never being satisfied that we're there. I mean, that's part of the excitement about quality assurance. Quality assurance to me isn't saying, oh, you did that wrong, well, you should be accountable for this. It's about saying, hey, we are never, ever satisfied that we're doing it good enough. We're always going to be on a journey to do it better, more efficiently. We're always going to be on a journey to work for new partners with the goal of improving population health. Never lose that thought. All of this effort is about improving population health. And whether the population you work with is WIC or CCS or in the EMS community, you do have some sort of semi-defined populations. Those populations matter, and they are large enough cohorts to actually influence overall county health statistics. We talked a little bit about collaboration. The journey to accreditation to me is also exciting in that it causes us and gives us pause to think about new partnerships, academic partnerships, nonprofit partnerships, delivery system partnerships, and that's actually a little bit of an awkward journey for us because we see ourselves as a discipline on a whole different end of this continuum. And why are we spending so much time? Why is Dan constantly talking about the delivery system? Well, they have 98 cents of every dollar. And the very fractional parts that comes to public health is minuscule compared to what we really need to invest in population health in this nation. And because of national health reform, that entire delivery system suddenly is actually going to be financially incentivized and penalized if the populations they serve, health is getting worse. If readmission rates to the hospital don't get better, that is, Dan had a heart attack and he was right back here in 20 days. Who dropped the ball? It ain't just Dan's fault. It's the delivery system's fault, and we're going to penalize you. So suddenly you've got a whole delivery system, again, with more than 98 cents of every dollar in their pocket, basically. And that includes the insurance companies and how they flow through money out to delivery system partners. All together on the hook now for population health improvement. And yes, their populations are their count of lives or the number of clients in their medical home. But it's still large enough cohorts to matter to us. Because the things that we do in public health, whether it's tobacco prevention, water fluoridation, seat belts, retail licensing for tobacco smoke, a sugar tax on sugar-sweetened beverages, that's another sort of controversial but really important strategy. All of those things actually improve the health of those cohorts. But frankly, we need the delivery system's resources to help us move a little more upstream. And finally, because of National Health Reform, they're starting to think about, wow, public health has something really significant to offer. It also improves communication because we are committing to continuing to work with all of you. You've seen, we're going to do a kind of a wonderful game show here in a minute. You've seen the posters. You'll see another video clip before we let you go today. But really, this is a commitment, a long-term commitment. We're not going to start something and not finish this. We're going to commit to following through, which means that we're going to be doing a lot of communication. And I mentioned, and I recognized a few minutes ago, this amazing, small but amazing communication team we now have in the department. We couldn't have had more luck in finding just an outstanding team. And Danica, Johanna, and Amy Cornell, and under Ray Waddell's leadership, have really taken the imaging here to a great level. I'm really excited about this, but we're going to talk about it at staff meetings. You're going to be drowned, frankly, in accreditation, and so I hope you like the taste, because you're going to get the flavor kind of day in and day out constantly, but that's a good thing. From time to time, if you sort of lose sight of why are we doing this again, please ask, please be involved. Each of those 12 domains that we mentioned have individual work groups. If you have particular interest in those, please talk to your supervisor and manager about how you can be involved. Ask your supervisor or manager about how does this translate back to my program? How does this involve us? And we should have answers to that, for sure. So, this is just, again, a summary of the top 10 reasons. And I think I turn this back over to somebody else at this point. Don't I? No? I'm still on? I should have read the clip. This is scripted. It is. I told you guys, you're lucky because you get to be here first. You get to get back out of here early today, probably. The bad news is you get to hear it first. So, let's do that again. I went a little fast. Okay.